Good afternoon, everyone. Welcome to the first webinar in a series of webinars for the African Society for Air Quality. My name is Babatunde Awokola. I'm going to be one of the facilitators today, and my role will be to introduce the people that will give the call, give the talk rather, and also describe how the proceedings will go today. We're welcome from all our various centers and various regions of the world. And we believe today we are going to have a good time and get enlightened, and our knowledge of air quality monitoring, policy and health in West Africa will also be broadened. A few housekeeping announcements before I hand over to the next person. One of them is that questions will be after the talks have been given, and we need to look below our screen and use the question and answer facility to type in our questions as the talk goes along. That way we will not forget really good questions that can generate nice scientific discourse. In addition to that, Dr. Bertrand Chanche will introduce Africa Society for Air Quality to us after I finish talking. And then once he finishes that, I'm going to introduce the speakers for today, and then we'll go into the main talk to be followed by questions and answers. And the last thing will be closing remarks from Engineer B. I don't want to misspell his name, so I will just call him Engineer B, who will wrap up the session for us. Once more, we are all welcome. I'm going to hand you over to the able hands of Bertrand Chanche. Thank you.
Thank you very much, Babatunde. Well, I'm going to try in a few minutes to tell our participants what is the African Society for Air Quality. I've prepared a few slides, and I hope I will be able to share that slides now with you. Just give you 1 minute for that. So I hope you are all seeing my screen. Okay. Well, I'm going to try in a few minutes to tell you what is African Society for Air Quality about. The agenda goes like this. We have a general introduction. And then I will talk about ASAQ, the concept, the context in which it was created, to explain why we have chosen the name and the scope, and talk about the purposes and the membership, and with cooperation and collaboration we are trying to have with other organizations. Well, when we talk about the air pollution in Africa, in general, we talk about the contamination of the indoor or outdoor environment. Okay, this means that we have normally the natural air, we have some substances in it, and then we can have some other agents that can come in. And when these agents become harmful, so we talk about say when we have pollution now. One way we're trying to measure the level of this pollutant in the air. And we use sometimes what we call the air quality index, which is based on the concentration of different pollutants that we can have. As you can see on this table, we're having different levels. We can have good, that is means when you have the green color, it means that you are good. When it becomes yellow, you have moderate. When it becomes unhealthy, then we change again. So when you reach the red color, it means that it's becoming worse. So this is how we can try to make the difference between what we call, when we talk about air pollution and when we talk about air quality. Usually we have 6 pollutants, okay, that are used in order to, to build this, to establish the air quality index. And these are carbon monoxide, diluid, nitrogen oxide, the ground level ozone, the particulate matter, and sulfur oxide. But we can also have other pollutants. These are not the only ones we can have in air, but we have other pollutants like benzene, fuel oils, okay, synthetic vitreous fibers, and so on. And what are the sources that we can have? There are many sources of these pollutants. We can have the household combustion devices. Okay, as you can see on the picture, this is what we have. This three-stone fire that we have here in developing countries. We can have a combustion of diesel oil or petrol in motor vehicles. We can also industrial facilities, forest fires, waste burning, and dust. Okay, these are the sources of these pollutants. And when we have these pollutants, it has an impact, I would say, a negative impact on our health. The condition, we can have asthma, we can have some chronic diseases, we can also some heart attacks, okay, hypertension, and also this is something that we found of recent that also can lead to dementia. And the body reaction to air pollution will depend on several factors, and it will depend on age, of course, on overall health of the person, and it will depend also on the amount of the contamination the person exposed to. Well, when we talk about air pollution in the world in general, it is said that we have about 5 million people, 5 million deaths each year. Okay, and this is one of the leading risk factors for death in the world. As you can see on the graph, you can see here that air pollution is yes. So air pollution comes on the top here in red. So it means that this is something that you can take into consideration. That is, I mean, the risk. Okay, the death risk is very high when it comes to air pollution. So it's very important factor. And also something that we should know also is that it is most of the time in developing countries that we are having. I mean, this. I mean, that situation is worse. I'm thinking about Africa and Asia. Well, it is said that globally, 1 in 10 deaths is due to air pollution in the world. So this is a fact that we should take also into account. Well, globally, as you can see on the picture, the countries you see in blue are the country where you see that most of the time the air pollution has a great impact, okay, on the health, on the number of deaths, okay. As you can see in Africa, for instance, we are here. This is Africa, and we are between 7.5 and 10%, okay, of deaths due to air pollution. Okay, this is for the case of Africa. While in the rest of developing countries, we are less. We are between around 2%. And in Asia, and mainly in China and India, you see that the situation the percentage can be higher, goes up to 15%. So the places where air pollution is really a problem, most in developing nations that are based in Asia and in Africa. And we can also talk a little bit about South America. Well, let us talk about specific case of Africa. As you can see on this map is a map where you have the monitoring station, I would say like this, in the world. And you can see in Africa that we don't have monitoring stations in Africa. It is only almost blank, okay, as you can see. And this means that you don't have data on air pollution in Africa because we have not been putting monitoring stations almost everywhere in cities and also suburbs in Africa, okay? And what we are seeing on the ground, in opposite to that, is that we are seeing a high level of pollution in cities, okay? If you ask people in Africa, they told that, yes, we are seeing that the culture of air has changed, okay? And also in the hospital, we have seen also the increasing cases of diseases due to air pollution. And we don't know what the government are doing, actually. We don't know if the population are aware that air pollution is a threat. And what about the research on air pollution in Africa? When we make a research survey, we can have some few papers coming from Africa, but we need to have a database to have the whole picture of the air pollution in Africa. And also, we don't have that much events, okay, on air pollution in Africa. So these are the main constatations that we made. And that's why we said, well, maybe it would be good to have a forum, at least a group of researchers that will be working or dealing with this issue in order to see what we can do when it comes to air pollution or to air quality in Africa. And this is why this group was put in place. So the group was put in place was in June 2021. This was this year. And when we talk about ASAQ, this is the African Society for Air Quality. So this is a name that was chosen. It is a non-profit organization. Okay, so we are just researchers and specialists. Okay, that are working on air quality. Okay, now, well, we have put this in place because we want the knowledge exchange on atmospheric pollution in Africa. So this is the main idea that we had in mind when we put this this group or this network. And also, the ASAQ is an interdisciplinary association. So this means that here in ASAQ, we find people coming from different backgrounds. We have physicists, we have chemists, we have people we have geographers, we have people from medical science. Okay, and it's very open to all the disciplines and to all the type of specialists who are talking about okay, who are working on in the field of air quality or air pollution in general. So, and the purpose, I will try to, okay, in few words, to talk about the purpose. So the purpose is to bring together specialists and researchers working in the field of air pollution in Africa. And we try to enhance the collaboration among them to raise also the awareness on air pollution in Africa and advise government on other institutions. And also, in order to be more precise, we aim to stimulate research and raise awareness on air pollution in Africa by providing a forum, okay, by facilitating the exchange of resources and information, by encouraging development on leakages and research contacts between scholars in Africa and elsewhere in the world. And also, we are looking at cooperating with other bodies with similar objectives throughout the world. So when it comes to membership, as for now, we are close to 18 members from 13 countries, okay? But what we are looking at is to have all the nationalities, African nationalities, all the African countries represented, okay? And we are really open to all the specialists, okay? Whether they are based in Europe or in Africa or in Asia, we don't mind. What we are looking at is the focus. If they are focusing on air pollution and specifically on Africa, then they are welcome to join the network. Well, we have set already a LinkedIn page. Okay, this is already done. And also we have a WhatsApp account for those who would like to join. They can maybe put their numbers. They send me the number, okay, at the end of this session, so I can put them on the WhatsApp account. And also, I would like to invite those who are attending this seminar also to go and connect to the LinkedIn page. We are looking at putting in place also our website. It's still under construction. Engineer maybe will give us few information about that at the end. And also we are looking to put also in place a YouTube channel so as to upload all our videos. Now coming to cooperation, because this is something that we are really working on it. We are trying to connect with other groups in Africa, and we have almost identified some of them, like the EPINA. We are looking to collaborate with them. They are based in Southern Africa. We have also connected with CAPSNet. This is a network of networks, okay. Africa Air. We have contacts with Mike Giordano and so. There's another group called ANGA. This is a group on atmospheric science. We are also in contact with Rebecca, who is the one who is in charge of managing that group. Okelo from ACA, this is the African Center for Clean Air. We have invited him. I don't know if he's online, maybe before the end of the session or at the end, he can give some few words about his organization. We have also the Pan-African Center for Climate Policy. We are looking at contacting them in a few weeks, okay, in upcoming weeks to see what we can do with them. There is also an African Climate Change Fund, okay, at the African Development Bank. We are going to see how to approach them. And at the end also, there's a fund, a foundation, I will say, the African Climate Foundation. We are looking also to contact them to see what we can, how they can establish links and collaboration with them. Now, this is what I've had to say for now. I will thank you very much for your attention. I will give back the floor to our moderator, Babatunde. Thank you very much.
Yeah, thank you very much, Bertrand. Without much ado, I'm going to introduce the facilitators for today's webinar. And we have two knowledgeable women who take us through air quality monitoring, policy and health in West African cities. So the first is Eva Pilot, who is a docent and researcher in the Department of Health, Ethics and Society at Maastricht University's Faculty of Health, Medicine and Life Sciences. She holds a diploma degree in geography from Cologne University, Germany, and also studied health geography, urban planning, ethnology, and economics. Her research interests covers health geography, health and environment, health surveillance systems, focusing on early warning using syndromic surveillance, health law and governance, and health systems research. She has worked in China, India, Brazil, the European Union, and Africa. She currently teaches Global Health Master and European Public Health Master programs at Maastricht University. Finally, she co-chairs the International Geographical Union Commission on Health and Environment Researchers Network and is an active member of the Indian Research Academy. Also, we have Celia, who is a PhD researcher for the Research Center for Medicine, Science, Health and Society at the University of Paris. She has a master in global health from Maastricht University and has a specialization in community health promotion from Spain's UNED University, which is the national university in Madrid, Spain. Her interest includes community health interventions, health policy, and environmental health, and she has worked in Spain, Colombia, the Netherlands, and France. In 2020, she began studying air quality and health in Africa, and she continues to do so in her current research. Ladies and gentlemen, join me in welcoming Eva Pilot and Celia Mer. Over to you, Eva and Celia.
Thank you very much. I think Bertrand, I need you to stop sharing your screen so that I can share my slides.
Okay, let me check that.
Maybe while you're figuring that out, I'm Eva Pilot, as already introduced, and I do not need slides. So maybe I already start while you maneuvering through the procedure of getting the other slides activated.
Good idea.
What I wanted to briefly talk about before we get into the example of West Africa and air quality monitoring and policy specifically is to widen a little bit the concept. So today I wear the head of the International Geographical Union Commission on Health and the Environment, where I'm a steering group member in. And one of the leading things we are going to focus on in the next years is specifically as well air pollution, environment, and health aspects. And what is really relevant for that specific group, which is as well part of the International Science Council, and it's basically something like the UN for geographers. And then specifically it's organized in commissions, and the one where I'm part of is environment and health. We look into interdisciplinary science specifically because of environment and health aspects. You really need to have a broad perspective in it. And it's therefore, I think, specifically interesting as well for the IGU to be part of such a great initiative to connect and collaborate with members to also facilitate additional partners and other ways of where that can be beneficial. So I'm very happy to do that as my part for the African Society for Air Quality, and try to put that a little bit higher on the radar and help to facilitate connections, but as well topic relevant. Air pollution and health is a very relevant topic, as already indicated by Bertrand, specifically linking environment and health aspect, as this is a leading cause of death and diseases. It needs to have a very interdisciplinary approach of research to really connect different edges of science. Because, and I think that's also something which Celia will talk a little bit about in her presentation, it really lacks often a comprehensive intersectoral approach to connect bits and pieces. So often we do have a lot of research from, for example, the epidemiology side, where we look into data from the healthcare sector, but we avoid looking also into monitoring systems and how are they actually established at the other side to really compare a comprehensive system. We do need to get a glimpse of system developed for air monitoring, because this is basically the entry points of evidence-based decision-making. Without any data available, we rely on estimates, and we rely on different surveys which are conducted. And this often is a challenge for research on one side, but specifically as well for warning and early warning for society in case of risk factors or certain exceeding air quality threats. So I think here that we have to really look deeper into it and see how that is relevant for the societies and how we can facilitate that further. Data collection and monitoring is one crucial aspect in that, and it needs to have an integrated surveillance approach. And that's also where I focus on in my research. I look really into integrated disease surveillance system, but it doesn't look just at disease surveillance, but it also looks into more a One Health approach, where we really facilitate environmental aspects, animal health, but also human health. So really, how do we can interlink that? And what we do have as a lack of not having a surveillance system yet really established in Africa, I think we also have an opportunity. We have an opportunity to design systems and come up with systems which are integrated within the countries, but maybe at one point even beyond, and really facilitate an interconnected surveillance possibility, where we do look into environmental monitoring, but maybe also not forget about the health aspect and try to make further evidence on how we can link that to health science and how we integrate that into the aspect. So although we do have challenges, I try to look at the brighter side and look at opportunities. And I think that's something where we should all focus on a little bit in the future. How do we can facilitate the next steps of monitoring networks and interlink that into a wider network for air quality enhancement in Africa, but specifically on an integrated manner, and linking that beyond the environment to the health sector and other sectors as well. And this is so far it. And then I would like to give to Celia, and just emphasizing on one of the examples where we looked as well into the challenges of previous evidence. And I think we really have to focus as from a research perspective on creating further evidence and seeing how we can maybe help and facilitate that within the network to collaborate and exchange knowledge in this regards. And Celia, now it's your turn.
Great, thank you. Thank you very much, Eva. Good morning or good afternoon or good evening, everybody, depending on where you are joining from. I would like to thank you all for being here today, and I would like to thank the African Society for Air Quality for inviting me to speak today. Thank you also Babatunde, Bertrand, and Eva for the nice introductions, which fit in very nicely with what we will discuss today. My name is Celia, and I'm a PhD researcher at the University of Paris. And today I am going to talk about the research that we carried out in the summer of 2020 on the status of air quality monitoring policy and health in West African cities. So just to give you an overview of what we're going to discuss today, I'm going to start with a very brief introduction just to set the stage, but we already had a very, very solid introduction that was provided. I will then go into the objectives and research questions that we formulated given this context. We will then go over the methods. I will summarize the results, and we will finally state the work and research that other partners are currently carrying out in the field. Finally, we will have a round of questions, and I say questions, but this can be a discussion, so please feel free to take notes and provide any feedback or ask any questions that you may have at the end of the presentation. So I'd like to begin by showing you the first page of our publication, which was published in the International Journal of Environmental Research and Public Health. I would like to especially mention the two other co-authors which were not able to join today, Bertrand Lefebvre and Renaud Ourcade. They continue to be very active in the field, so I am sure you will get the chance to interact with them at a future time. And without further ado, I will begin the introduction. I won't go too much into the details of the harms of air pollution on human health because we already had a great introduction, and I'm sure you already are familiar with all of this information. But I would like to state that in our study, we focused specifically on urban air pollution, to which 99% of people living in cities are exposed to at unsafe levels, according to the World Health Organization. So as we know, this carries with it numerous consequences, which lead to an average of 4.2 million deaths across the globe every year. The number that we saw before was a bit higher, and that's because it includes household air pollution as well. But in our study, we only considered ambient air pollution. So that's why we stuck with this figure of 4.2 million deaths each year due to this cause. It should also be stated that of these 4.2 million deaths, 90% of them occur in low and middle income countries, many of which are located on the African continent. Indeed, the effects of air pollution have been studied and known for decades now, and high income countries have had the opportunity to address this through the implementation of standards and laws, while it seems that other regions of the world are falling a bit behind in this regard. And the question of why this is actually the case is the subject of my current research. But at this stage, what we wanted to know is just how much is being done in low and middle income countries in Africa to monitor, regulate, and control urban air pollution. How much data was available, what was known about the health effects, and what laws were in place. Since we couldn't study the entire African continent, we decided to focus on one specific region, which was the Economic Community of West African States, or ECOWAS. This region comprises the 15 countries that you see highlighted on the map. And when it comes to air pollution, its situation is quite delicate for a number of reasons. So firstly, this region has undergone an immense amount of growth and development over recent years, both in population. So just in 2020, there was an average of 2. I'm sorry, I think we have some echo. There is a mic that has been turned on. Thank you. I'm sorry about that. Just in 2020, the region increased its population by an average of 2.6%, which is extremely high. And this has carried with it economic development, industrial development, and growth overall. So the cities in these countries have also grown extremely rapidly. And along with that, the amount of vehicles in these cities, as well as the industrial activities that are carried out in and around these cities, they have all greatly increased in recent years. Secondly, besides all this man-made pollution, the region is exposed to a baseline level of natural air pollution that is quite high due to its proximity to the Sahara Desert. So during the dry season, especially, there are strong winds that carry dust and sand into the cities. So it really contributes to the pollution of these cities' air. This is a phenomenon that has interestingly been studied for other parts of Africa and even Europe and Asia, despite how far away they are from the desert, but not so much for ECOWAS. So there is really not that much that is known about the effects of this on human health. Thirdly, there seems to be insufficient legislation or low enforcement when legislation does exist in these countries. And it also seems that the issue of air pollution is not necessarily prioritized at the government level in all cases. And finally, as low and middle income countries, these countries are exposed to other public health concerns, such as infectious diseases, and also sometimes have fragile health systems that demand attention and resources, which also contributes to not necessarily prioritizing air pollution at this time. So I'd like to show you an image that we published with our article that was created by one of the co-authors, Bertrand Lefebvre, which shows the cities that we included in our review. So we included all capital cities and all cities with populations higher than 500,000 inhabitants, which, as you can see, there are quite many of them, meaning that there is an increasing number of people that is exposed to this problem of urban air pollution in West Africa. So given this highly under-researched region with such a rapidly growing population and such a particular scenario when it comes to air pollution, we decided it would be interesting to understand exactly what is currently being done to address air quality in the area. In order to propose solutions to a problem, one must first have a grasp on the extent of research that already exists. So we thought that a review would be an appropriate way to gather all of this information and capitalize it to see what data was available and what data was missing. So with all of this in mind, we came up with our research questions. Here you can see our main question. So what is the present state of air quality monitoring policy and health effects in ECOWAS cities? In order to guide this main broad research question, we had some sub-questions that we formulated as well. So what are the main contributors to ambient air pollution in ECOWAS cities? Which ECOWAS cities currently have air quality monitoring sites in place? What standards or regulations exist regarding air quality in ECOWAS cities? And are links between air quality and health known and understood and considered in policy, which is also one of the main focuses of the research. So now we can go into the methods. In order to answer these research questions, we decided to opt for a scoping review or scoping study, because the objective of a scoping study is to examine the extent, range, and nature of research activity and to highlight gaps in the literature, which is exactly what we wanted to do. So it fit very nicely with our objectives. The research question, as you saw, was quite broad, but we wanted this to include as many studies as possible. And then we guided our main question with our sub-questions to make sure we got all of the right information. We followed the methodological framework by Arksey and O'Malley, which is the reference for scoping studies today. And this framework has the steps that I will detail now. So we started with a keyword search. We had a very large query comprised of many terms related to air pollution, the ECOWAS cities that were included, and health effects. We searched several databases and also gray literature sources, so the government websites of all 15 countries, the WHO's website, and other relevant international agencies' websites as well. Then, once we obtained our results, we scanned them several times, filtering out as we went along. The included studies were read thoroughly, and the main themes were identified. We charted this data onto a spreadsheet to help guide our results section. And finally, we conducted interviews with experts in the field to confirm our findings and fill in the gaps that the literature may have left. So to give you an idea of the number of studies that we were able to include through this method, we started with a total of 815 studies after duplicates were removed. 785 of those were articles, and the rest were gray literature sources. We then used our exclusion criteria as we went through the filtering process. So we excluded studies that were published before 1990. We excluded studies if they did not include an ECOWAS city of our concern. If the focus was excessively on indoor air pollution, we also excluded the studies as we were really focusing on urban ambient air pollution. And finally, if the focus was excessively on another form of pollution that wasn't air pollution, we also excluded those studies. So we started with title screenings, after which we were left with 246 articles. We read the abstracts of all of those and excluded 208, and then we fully screened a total of 38 studies, of which 7 were excluded and 31 were left for final inclusion in our results. So very quickly, this is how we summarized our findings into the 4 main categories that you see here. So we have polluting activity, data and monitoring sites, regulations, and finally recommendations, because there were a few studies that focused specifically on recommendations for this area. Health effects were addressed within each subsection, but in this presentation, I will dedicate a section specifically to health effects. I also wanted to highlight the interviews that we were able to carry out as a complement to our research. So the study was carried out right at the onset of COVID, and it was a bit difficult to contact experts. We wished we would have been able to have time to talk to more people, but in the end, we managed to speak with 5 experts whose countries of expertise you can see here on the screen, and their findings were extremely useful for our research. So I'd like to thank them once again for their participation. So now I'm going to go into the results. I'm going to really quickly go through each of these categories and explain what the articles, what the studies, and what the interviews were able to provide to us. We will start with polluting activities identified for ECOWAS. We already heard a bit about this in the introduction, but basically polluting activities in West Africa seem to come from sources related to the population growth and development that the region is currently undergoing, which is expected. Vehicle emissions were frequently mentioned in the countries that you see highlighted on the screen, so Nigeria, Ghana, Mali, Burkina Faso, and Benin. Aside from this rapidly growing vehicle fleet that we mentioned earlier, these vehicles are often secondhand, so quite old. They are sometimes unmaintained and use lower quality fuels, although this is starting to change. There are many countries that are implementing fuel standards and that are also limiting the age of secondhand vehicles in the country. It also occurs that many roads are unpaved. So when there is traffic, dust is lifted off of the roads, which contributes to overall particulate matter pollution. Industrial activity is also an important contributor to air pollution in ECOWAS cities, especially for the large cities in countries such as Senegal, Guinea, Mali, Togo, and Nigeria. Important industrial activities in this region are quite varied, but they include cement and plastic factories, mining, and the oil and gas industry, especially in the case of Nigeria. And what happens is that also these factories are very often located quite close to residential areas in cities, which can pose serious risks to human health. We also found information on pollution that is stemming from the growing energy needs of certain countries. So as the population grows, the energy demand is higher. And in countries like Nigeria, many individual homes use diesel-powered generators due to an unstable power grid. There are other issues as well related to improper waste management, which sometimes leads to waste burning in some cities. This was especially mentioned for the Ivory Coast and for Ghana. Here we can see an image of the famous electronic waste site that is located in the city of Accra, which many people work in and are exposed to serious levels of air pollution stemming from this site. Finally, although this was not a main focus of the study, there are cities such as Accra, again, in Ghana that continue, whose citizens continue to use fuel and wood for heating and cooking activities. This is the case especially in low-income neighborhoods, which also serves as a reminder that the effects of urban air pollution are sometimes more severe on some than on others. So aside from affecting the health of the people that continue to use fuels for cooking and heating, much more seriously, the pollution stemming from these sources also contributes, sometimes importantly, to overall ambient air quality in these cities. Now we will discuss what we found concerning air quality monitoring data in ECOWAS cities. So as it was mentioned earlier, there is not much data as of today in West African cities, but there are a few exceptions. One of those is yet again Accra in Ghana. There are currently about 15, maybe even more by now, air quality monitoring stations distributed throughout the city and the region surrounding it. And this network is a result of the air quality management plan that was implemented by the Ghana Environmental Protection Agency in collaboration with USAID and the US Environmental Protection Agency in 2018. So Accra has actually been monitoring air quality since 1997, but this new recent plan has really pushed it to the next level and will continue to develop over the coming years. We also identified 6 air quality monitoring stations distributed throughout Dakar in Senegal, which are run by the city's Air Quality Management Center. In Nigeria, there were indications in some literature that there has been monitoring activity in the past, especially in Lagos, but it seems that these stations are no longer operational. There are, however, plans to implement an air quality surveillance network, thanks to the air quality management plan that is being implemented by the World Bank. There may have been progress undergone since the research was carried out. I am unaware, but there are definitely plans to implement a surveillance network in the coming years. For the rest of countries, either no information was found or simply plans to implement air quality surveillance in the future were mentioned. That was the case for Burkina Faso, Ivory Coast, and Mali. And we should also conclude with mentioning that the Stockholm Environment Institute is aiming to develop a low-cost sensor network across the cities of Accra in Ghana, Lomé in Togo, and Abidjan in the Ivory Coast in an effort to promote regional cooperation. The idea is that these low-cost sensors will collect open access data that will be available to everybody to promote collaboration and capacity building. So again, this was a plan that was mentioned that I was able to find last year, and I am unaware whether progress has been made since then. When it comes to regulations and standards in West Africa, we saw many countries with some sort of environmental legislation or standard that date back as far as the 1990s. Nigeria, for example, has air quality standards and vehicle emissions regulations published in 2014, I think, and they have a relatively solid institutional setup to back up these laws. But it seems that enforcement is lacking in the country despite the available legislation. In Senegal, regulations date back to 2003, which we found to be slightly old compared to the recent progress they have made regarding air quality monitoring. In Ghana, at the time of the research, they had yet to promulgate their air quality and vehicle emissions standards, but my recent research has allowed me to find out that they have already published those, so those are now available. In Burkina Faso, Benin, and Mali, they all have standards of air quality or vehicle emissions dating back to 2001. But as we saw before, they do not have any monitoring stations in place to compare against the data that they would obtain. So it's a bit lacking in that regard. And finally, there are countries that continue that until they have air quality standards that are promulgated, they use the WHO's guidelines as a reference. And that is the case for the Ivory Coast, for example. I would also like to add that for countries that do have standards in place, their limit values, as you can see on this table, were often several times higher than those recommended by the World Health Organization as safe for human health. So despite guidelines being in place, these may not be sufficient to protect human health. And if we consider the WHO's latest update to what safe particulate matter pollution levels are, these values are higher still. So this is something to consider. If we go towards the health effects of air pollution in West Africa, we can conclude that very, very few studies mentioned specific health effects for this region. So very few targeted studies were carried out comparing air quality and health effects on the population in West Africa. We can mention a few, however. There's the Daxiwa project that was carried out in the Ivory Coast that intended to compare particulate matter pollution levels with hospital visits in the city of Abidjan. There was also a study in Senegal that used the Ministry of Health data actually to understand respiratory diseases in relation to air pollution. So they modeled air quality across the country and compared that to various respiratory conditions. Here, I'd like to show you simply two images that we took from the study. So they modeled air quality in the region here, and they tried to compare it to asthma prevalence for individuals under 5. And finally, there was a study carried out by the Ghana Health Service in the early 2000s after the phase out of leaded gasoline, and they tried to assess the effects of lead pollution in the population. But as we can see, these studies are present, but not very sufficient and not very detailed, and some of them are quite dated as well. Finally, we can conclude the results section with some of the recommendations that were found in the literature and during our interviews. So one of the main things that was stated in the literature is that in order to reduce vehicle emissions, urban mobility in ECOWAS cities should improve, especially through public transport. And efforts should also be taken to reduce the age of the vehicle fleet and improve fuel quality. So there have been steps, as I mentioned before, that have been taken in this regard. Many countries have now limited sulfur content in fuels and have also limited the age of vehicles to 5 or 10 years. So this is definitely progress that is being made. It was also recommended that stricter laws be established and enforced, as this seems to be an issue in ECOWAS countries that do have legislation in place. Data acquisition also needs to improve in ECOWAS cities and countries for air quality, but also for the associated health effects, because this would be key to evaluate the effectiveness of the laws and policies that are implemented or that will be implemented in coming years. So there should be more data in general, but also more coordination amongst different data sets that can be gathered. Studies also mentioned how public awareness of the risks of air pollution on human health needs to increase because there are still many cultural practices in ECOWAS that are polluting and harmful to the health of the individuals that practice them. And unless they are aware of these consequences, these will probably not change. So this is something that needs to be addressed, and that will be helped with more availability of data. And finally, many interviewees and many studies also requested stronger regional cooperation. So this is important because, especially for ECOWAS, transboundary air pollution is a serious concern because of the strong winds that we mentioned occurring, especially in the dry season. So even if there is one country that is making important progress regarding air quality, this progress will be hampered by a neighboring country if they are not addressing their air pollution needs. So there seem to be several opportunities for regional cooperation and capacity building that should be further explored so that the region can advance together in the fight against air quality. So given our findings, there are many points for discussion. I have just summarized a few here, but again, please feel free to add more points for discussion at the end of the presentation. Firstly, what we can see is that even before considering all this anthropogenic air pollution that we have mentioned throughout the presentation, ECOWAS is already in a very vulnerable and unique position due to the natural air pollution that it experiences, and also due to its geographical location, which makes it quite vulnerable to the effects of climate change. So if on top of this we add the man-made air pollution and the effects of climate change that are surely to come in the coming years, we are faced with what could be a very concerning situation if no action is taken soon. It is also clear that there is really not much literature on the status of air quality in this region. This has been brought up also by a few authors over the years, because it seems that in general, sub-Saharan Africa, but also ECOWAS in particular, are excluded from studies that concern air quality and health. And this has just contributed to setting the region further behind when it comes to better understanding what is going on. The fact also that we are here today will hopefully shows that this is starting to change, but as of yet, the region is definitely highly under-researched. It is clear that there are few air quality monitoring activities that are being carried out in ECOWAS as of now, but hopefully this will change in the coming years as well. There are some hopeful signs that this will be improving soon. But what we know is that this needs to continue to increase. Data is essential to verify that standards are being met, to raise the issue on the agenda, to make it more prioritized by governments, but also for this data to be disseminated to the public, as we said before, so that citizens can also contribute to the fight against air pollution and change their behaviors to better protect their health. There are, however, reasons why air quality monitoring progress has been slow in Africa, and that is often related to the extremely high costs and resources required to setting up, installing, and also maintaining air quality instrumentation. So this is where the technology of low-cost sensors could definitely serve as an interesting alternative. But as of now, there are many calibration issues, and there are not standards yet for these devices. So although it's definitely an interesting prospect, the technology as of yet is slightly questionable still. And something that we have also reflected on during our research is that although data is essential, and we are fully aware of that in order for strong policies to be created, there are definitely other components that are necessary to ensure successful implementation of policies. So political will is essential, meaning the issue needs to be high on the agenda for governments, for all of the ministries that are involved in the problem of air pollution, which, as we know, is quite diverse, but also for other stakeholders, so companies and relevant members of governments, but also non-state actors. Also collaboration, both north-south. So some of the initiatives that we have seen are definitely the result of north-south collaboration, but also south-south collaboration, both within the region of ECOWAS, but also within Africa in general, should be promoted and should increase in order to ensure sustainable improvements when it comes to air quality management. We have noted, for example, that in ECOWAS, some countries monitor air quality, but don't have recent guidelines or standards, whereas other countries do have the standards in place, but don't yet monitor air quality. So that just serves as a small example as to how there could be exchange of practices within the region. Finally, we also have seen that the problem of air pollution is often viewed through different lenses or viewed with a different focus. We found this in the literature. So some state that air quality is simply the result of poor enforcement of laws that do exist, while others see urban air pollution as a result of poor urban planning, and others still see it as a consequence or as a cause of climate change and only view it from this perspective. Sometimes it seems that the focus strays from public health, which in my eyes threatens to remove attention to the very serious consequences and risks that air pollution has on human health. But this can also be seen as an advantage because it seems that the issue is quite adaptable to different scenarios. So it can be shaped to become attractive to different sectors so that everybody can be incentivized to take action against air pollution. And in the end, the result will be a benefit to public health overall. So although it sometimes seems a concern, it can be seen as an advantage. And I'm also curious to see whether you have insights on this. And with that, we are reaching the end of my presentation. I would very quickly like to highlight the current and upcoming research that will be carried out in the field by myself and by other research colleagues. So firstly, the French National Research Agency, or ANR, has recently funded a large project called Global Smog, which aims to better understand the policy processes related to air pollution in 10 global south cities across Africa and Asia. So all of the labs that you see here on the screen will be participating. And the study will aim to understand how the issue of air pollution is framed, how different actors interact, and the different issues and obstacles that are involved in regulating air quality in these cities. I will be working with the researchers in this project, and I will focus particularly on how international agencies define and frame the problem of air pollution and how this translates into local contexts. I have started studying the city of Casablanca in Morocco, and I have yet another city to select. So if you have any insights, that would also be much appreciated. I don't know if you have anything to add, Eva, about the project.
No, I think it's just really relevant that it's a starting project in the beginning of next year, and it's funded specifically from the French funding side, but it's reached out as well for collaboration to additional stakeholders and so on. So it's really an integrative approach in the project where it's also takes part in understanding the different initiatives which are already in place in the different regions. So it's maybe also a possibility to link and further network for the African Society of Air Quality.
Definitely. So that leads us to the end of our presentation, actually. Here we have the sources that were used for this presentation, but in our publication, you can find all of the references that we found and that we used to guide our research. So feel free to check that out. I hope you enjoyed. I would like to thank you very much for your attention and your time. And if you have any questions, well, now would be the time to do so. Thank you very much.
Yeah, thank you very much, Celia and Eva, for the very clear and enlightening presentation. So there's a question here for Celia as a way of starting off.
Yes.
Eunice Omanga wrote that on polluting activities, Celia, did you look at agriculture, for example, the use of fertilizers, pesticides, and so on? So Eunice from Kenya wants you to comment on this, please.
Yes, of course. Thank you, Eunice, for your question. So definitely agricultural burning was something that came up sometimes in the literature because smoke from this often does spread into cities. But as we were focusing really on urban air pollution and polluting effects in cities, this was not something that we looked into very specifically, to be honest, because it seemed like that was more an issue in rural settings, and that was not the focus of our research. I hope this answers your question.
Yes, so for everyone listening, please, this is the time for question and answer. Engineer B, I don't know whether people can ask their questions live or they have to punch it into the question and answer session. Question and answer facility, I meant to say. I don't know whether you can comment on that, engineer. Right. So if you have any question, kindly raise your hands and you'll be allowed to ask the question, please.
Maybe also just in the meantime, before the people may gather additional questions, I think one of the aspects which is also quite striking, and it also needs like really a global approach for research, is the aspect of growing vehicle fleet, and specifically the secondhand car use in Africa, where we have a strong link as well to Europe, where we see that specifically second car used, which are not according to the European standards, are now sent as well to Africa to be used in the African context. There are already some initiatives which tries to reduce that, and political decisions are made to not allow that. But I think there's also, from a policy directive, a quite interesting research which is needed to look into the collaboration of these kind of development aid, but actually not really contributing to positive development in regions. And I think that's also something which we could look into further, where that is also really needed. And we will have as well a couple of students working on that subject for the next term to look a little bit deeper into that. That's also in collaboration with the Paris University, where there was also some funding available to do that. So I think there are also sometimes small initiatives can already raise an issue, and maybe we can network further for the air quality network in general to make better use of these kind of collaborations.
Yeah, thank you very much, Eva, for that. So we have Carl Malins asking another question. Carl says that any information regarding the use of other sources of air quality data, for example, air quality models, satellite data, to inform air quality policy in West Africa? And is there any benefit and or difficulties with using these data sources? This is a very interesting question that always comes up in any air quality session. So I'm happy Carl is raising it. Let me allow Eva and Celia to answer the question, please.
Yes, thank you. Thank you, Carl, for your question. I'll start. Maybe Eva, you can fill in if I'm missing anything. So models came up a bit in the literature, but what it seemed is that without sufficient data, models are also not reliable. So although many people resort to modeling because of lacking data, those models are often not as reliable as they could be because the initial data input is not sufficient. So it's kind of a cycle. So although many people do use models because it's basically all that there is, satellite data is also sometimes used. Probably the quality of these models is slightly questionable simply because the initial input of data is not necessarily sufficient to make them as reliable as they could be. So there were some studies that did this, but again, not that many. There were not that many, and that's simply, I think, because of lacking data overall.
Yeah, maybe I just add slightly a bit on the satellite data. I think that's also a really interesting source. But as Celia also said, and I guess a couple of us already experienced that as well, is really we need ground data to cross-check first how well that is actually working. But for example, the European Space Agency is providing quite great satellite data images. So, and also sometimes they provide funding to actually establish the use of satellite data. And I think this could be something which is also maybe an opportunity to collaborate and gather funding for a specific cause on testing satellite data and on maybe a smaller scale to see how that is actually operational and what is the added value of satellite data for air pollution research. Because and that's probably the case for different agencies too. But what we see is as the European Space Agency, for example, they received funding from public sources, they also have to prove that this is actually beneficial. What are the added value of satellite data? So I think this is a great opportunity, and we should dig deeper into it to identify maybe a funding source where we can look deeper into such kind of technology use.
I also recall a study from from Nigeria, and also one of the experts that we interviewed, stating that the future of air quality surveillance in Africa is probably a combination of all of the technologies that we've been mentioning. So as Eva was saying, satellite data with low-cost sensors, with traditional or more traditional air quality monitoring stations. So it's definitely interesting to propose integrated and combined solutions using all of this technology, because the cost is lower and progress can probably be achieved faster in that sense. So it's definitely something to look into.
Thank you, Celia and Eva. Bertrand asks a question here, saying that have we looked into environmental topics or air pollution in educational systems?
So in school systems or in university curriculums, to be honest, no. I have only spoken to a few researchers that come from those countries that have focused on air pollution. What it seemed is that in some countries, communication with the scientific community was stronger than in others. That was also something that some of the experts that we talked to mentioned. And this is maybe something also that should increase going forward, so that governments are in close connection with the research community, so that they can better work together and make more strategic decisions, and also maybe shape university curriculums in that sense to kind of create the future expertise that we need to have in order to continue working on air pollution in Africa.
Yeah, thank you. I agree with that. And Busisiwe Shezi directed this to Celia. Now, I'm not sure whether this is a statement or a question. It says in West African countries, are there buffer zones? So this is a question. Are there buffer zones between pollutants generating activities and residential areas?
Yes, so it doesn't seem to be the case everywhere. I think I have read somewhere that even in Ghana, there are polluting activities that are as close as 100 meters from residential sites. So although industrial activity sometimes is concentrated more on the outskirts of cities, it doesn't seem to always be the case. So sometimes they are in very, very close proximity to polluting activities, and the effects of this are not necessarily studied. But no, I would not say that there are always buffer zones.
And I guess what we also have to consider is the informal settlement. So, I mean, even if you may have buffer zones, then you may still have people living in these buffer zones, which creates, again, the aspect that we have an inequality aspect with environment and health, where we really have low socioeconomic groups more being affected than others. And that's really something which needs to be highlighted.
And this will only continue to increase because the population is growing, and urbanization is also growing each year. So,
and I think what we have to consider is really, as there are a lot of initiatives, which we can also see within this network, which we may not have known about, that there are so many different groups already focusing parts and bits on this subject. I think what is really key is integrated collaboration and coordination, so that we really work together, and that we don't, with the little resources which are available and the little research which is conducted, that we at least really collaborate and see what is happening. And that's the same for the monitoring sites. So we have a lot of little funding sources, and maybe even NGO funding sources, or different government fund different parts of monitoring stations. We have to make sure that this is in combination. And for that, we need to have strong policy and political will, so that if there's funding available and monitoring sites do get created, they need to be embedded in a national plan or within a municipality plan, so that it's clear where the added value of that specific monitoring site is and where is it located. So if it comes to monitoring the air pollution overall, it's also key, where is this monitoring site located? Is it next to a highway, or is it in a city forest? So that's really relevant to have policies which guide these implementations and coordinate funding streams. And I think that's really relevant, particular for the opportunities we do have when not sufficient networks are available.
Yeah, thank you very much, Celia and Eva, for answering those questions properly. We have Bernard Nana from Burkina Faso, who wants to know what the purpose of the webinar is and what is expected from the participants. I think Bertrand will be in a better position to answer the question. Bertrand?
Yes, thank you, Babatunde. Well, to handing this question to me. Well, this webinar is about talking about air pollution and having an overview of the air pollution in West Africa. This was the purpose of this topic, of this webinar, and also share the findings of the work that has been carried out by the Iva and Celia. So this was the main purpose. And I want to say that this is the first webinar we are organizing in the framework of the ASAQ, and then we have more webinars. We are thinking about having webinars on the regional, or regional scale. Okay, talk maybe the next webinar could be, for instance, on Southern Africa or on East Africa or Northern Africa. So we have not yet decided yet, but we want first now to have the general picture of the air pollution, air quality in Africa, knowing what people are doing, what government are doing, knowing what researchers are doing also, and then trying to bring people together and share what we are doing. And also, I want to extend my invitation to other researchers or participants who are here that if they want to join the ASAQ, it is free. Okay, it is free. What they have to do is just maybe send me an email so that I can add them to the mailing list, or drop their email address or their WhatsApp account number. Okay, just to the chat so that I can integrate them directly on the WhatsApp group. Also, when we finish this series with regional overview of the air pollution in Africa, we are going to have maybe specific topics. Okay, we could talk, for example, on health effects. Okay, because when it comes to health effects, we have the dementia, we have a problem with lungs, cardiovascular attack, and so on. So it's good that we have people coming from medical science to come and explain how the pollutants, the PM 2.5, is affecting our bodies. So this is very important for us. We are looking at organizing one like that. We are looking also organizing one of instruments. We found out that the instruments are very expensive when we have to have monitoring system. This is what we found. Maybe the locals, as Celia was saying, is the solution. I have discussed personally this issue with several groups, okay, to have their opinion. And maybe we have a specific workshop, okay, on local sensors where we have manufacturers, okay, we have such people who have experience, who have used it, who have made some experiments here in Africa on that, like Africa Air, and also having some researchers from maybe from Canada, maybe from Europe, and discuss about the possibility to extend, okay, the networks of LCS in Africa, because as I show you on the picture that I show you, that we don't have data in Africa. We don't know what's going on the ground, and this is the first step. This is the first step. We need to have data. And look, when I make my survey, I found out that with $1,000, with $200, we can have a sensor, okay, that can be implemented somewhere. So it could be a solution, because when you look at the monitoring station that have been installed, even here in Dakar, some of these stations are not working properly because of the fact that the sensors that were installed are very expensive, you see. And maybe if you shift to local sensors, it will be easy for us to implement more networks in Africa. So this is some topic in which we are going maybe to look in it. And also, you have this policy issue that we don't know what the government are doing. Are they even aware that air pollution is a problem, that people are dying because of these pollutants? We don't know. So maybe we have also to organize a workshop where we call people from environmental agencies, okay, in Senegal, in Nigeria, in South Africa, and ask them what they are doing, okay? So, well, this is just to give you a small test of what we are going to do in the upcoming months. So I hand over the microphone, the floor to you, Babatunde.
Thank you, Bertrand. So in short, Bernard Nana, this is a situation where we as Africans and people living and working in Africa have decided to look at the problem of air pollution, quantify the problem, provide solution to the problem, create awareness, and get the relevant stakeholders interested in this problem. If we don't do it, nobody will come from elsewhere to do it for us. So that is the main essence of ASAQ, and the webinar is a way to ease into the process of doing all this. We expect everyone who is interested to join and help us in achieving this aim. Thank you very much, Bernard, once again. We have a question again from Eunice in Kenya, and this is to both Eva and Celia. She wants to know where there are areas or regions that stood out as having more people with air pollution related problems from your study.
Yes, so thank you for your question. What I would say is that there were regions that were more studied than others. So unfortunately, as we saw, there are not so many studies and even less studies on health effects. So there are probably many cities in various countries whose citizens are suffering from the effects of air pollution, but it is simply not known because there is no data on this. Many countries also struggle with data collection on disease and mortality and morbidity data. So even if we wanted to have this information, we wouldn't know. Studies that came up, Nigeria was quite studied, and Ghana as well. But I would say this is probably a problem that is occurring in all ECOWAS countries, and it's simply not as studied as it should be. So I wouldn't think that we are in a position to compare because there are countries for which we have basically no information. I don't know if you have something to add, Eva.
No, I totally agree. I think that the aspect is probably there are regions which stood out, but it's really about data availability at the end. And that's often the case. Sometimes if people talk about something, or if there's evidence, then people talk about it, but it doesn't mean that in other regions it's less a problem. So that's really important to remember. We need more information about the whole region.
Thank you, Eva. Thank you, Celia. Bernard stated that he works in the field of air quality, but he has never heard of ASAQ. I would answer that because ASAQ is actually, I would say, a baby organization. It's still in the neonatal period, the way we will call it, first 28 days of life. And we are getting our self together to start strutting and then start working and running in the field of air quality. So that is the reason why you've never heard of ASAQ. But we believe as time goes by, as activities and projects and collaborations come up, you will hear more about ASAQ. We'll take any more questions. We still have about 12 minutes, out of which engineer still has to close with remarks. But we can take one or two questions if we still have any. Questions now or forever hold your peace, at least on this particular webinar. Okay, so I would like to hand over to engineer for the closing remarks. And when Bertrand was discussing ASAQ, he made a mention of the fact that the work on the website will be commented on by engineers. So please, in your closing remarks, if you have any updates about the website, kindly comment on it. So Engineer B, please, over to you for closing remarks. I hope you're there. Yeah.
Yes, I think I'm there actually. Yeah, thank you, Babatunde, for moderating today's session. I think mine is easy to thank our presenters for the first webinar for the ASAQ. So Eva and Celia, thank you so much for sharing your results from your interesting study on scoping review on air quality monitoring policy and health effects in Western African cities. I hope you'll be able to extend this to other places that you are not able to reach. So thank you so much for taking time to share. My name is Engineer Baino Mugisha. I'm based at Makerere University in Kampala, Uganda, East Africa, where I lead an air quality research initiative that does technology development for air quality monitoring, modeling, but also providing evidence to inform policy engagement and awareness. And our work is called AirCo. I've just put a link in the chat for those who might be interested to check it out, the work that we're doing. So we started out in Kampala, Uganda, and we are soon rolling out to other African cities. Yeah, so back to my main role today. Once again, thanks to our presenters, thanks to our moderator and our main convener, Bertrand, for convening us and also starting this initiative on ASAQ. And of course, also thanks to all the participants for your active engagement during today's session. We look forward to future similar events. I think as we can pick out from the discussions, there are several areas that we might need to follow up either in depth or in geographical reach. I think it will be interesting to dig deeper, for instance, understanding how the different sources that you highlighted, Celia, how they contribute to the pollution. I think will be interesting to quantify what is the contribution of each of the different sources in the pollution, these different spaces. So very much looking forward to our next webinar. And once again, thank you all. The webinar has been recorded and we'll pass it on to the organizers, and we'll be able to share it beyond this event. Thank you so much. I wish you a very good morning or good afternoon or good evening, wherever you are. Thank you.
Thank you very much, everyone. Bertrand, any final words after the closing remarks of engineer?
Oh, well, just an invitation to participants for those who find it interesting to join the network so that we can have more and more members. Because what, as I said, one of the important things that we should do is to have members in all the African countries. So if there are people from Nigeria, from Liberia, from other African countries, they are welcome to join us so that we can share our experience on this issue. Okay, and also I want to announce that we have a second webinar. We have not yet decided on the topic. When we have our meeting, maybe next month, we are going to decide whether we are going to have a regional overview on Northern Africa or East Africa or Southern Africa. And I already sent a mail to Ernest, and an engineer. He didn't mention it, but I sent them the mail to ask them if they can see whether it is possible to have a webinar on East Africa. Okay, it would be good to know what's going on also on that part of Africa. So I would thank you. I would thank all the participants, all the panelists. Okay, and thank you also, Babatunde, to have accepted to moderate this session. And well, see you on in the second webinar. Yeah.
Thank you, everyone. Absolute pleasure. Thank you, Eva. Thank you, Celia. We'll say bye for now.
Thank you.
Thank you,
Thank
engineer.
you so much.
Thank you, Bertrand. Well done. And thank you, engineer, for hosting and recording.